Friends, good morning. I'm going to be talking about something different today, slightly different from what we heard earlier eminent panelists talk about, but would eventually tie it back in with how the private sector can partner with the government to help eliminate some of the challenges in delivery of effective healthcare to the citizens. I'd like to start with a brief introduction of our organization. United Health Group is one of the largest healthcare companies with a revenue of $122 billion globally. We work with 250 central and state government agencies, 2.5 lakh healthcare professionals, 6,000 hospitals, and 8 crore individuals globally. Our mission is to help people live healthier lives and make the healthcare system work better for everyone. Some of our key offerings are divided into two categories: health benefits and health services. Health benefits is where we provide insurance coverage to our members across multiple countries. About 3.5 crore people are under our coverage and plans. Health services is what is very important for us in this market, where we provide information technology enabled health services and platforms encompassing information technology products, turnkey implementation projects, mobile applications, healthcare data and analytics, and population health management solutions that we deliver in a public-private partnership model with the governments across the world. We've been operating in India since 2006, employ about 10,000 people servicing our global customers in the areas that I just mentioned, operating out of 4 cities. Our domain expertise and commitment has been recognized globally. We ranked at 17th number on Fortune 500 list. We are, and very recently honored to have been invited to fix healthcare.org website. So what I want to talk about is how data could be an effective foundation for a very strong healthcare system. So any healthcare system has 4 key players: the government, the care providers, the payers, and most importantly, the patients. All of them have one mission, that is keeping the patients healthy. And data, we believe, can help everyone do it better. Government wants to improve citizens' health and corresponding indicators, contributes a significant amount of funding, participates in care delivery as well as funding, and runs large-scale programs to improve health indicators at large numbers. Care providers want to ensure the best care for their patients within reasonable costs, but are hampered by lack of effective data and knowledge of clinical pathways, patient histories. Payers are able to make their decisions based on data, but could get better data. Payers are also very well suited to help all the players with providing this data, but they are stunts today at least. So let's look at how data-driven intelligence can help each of them do it better. I'll share 3 use cases for each of these 3 participants. The first one for payers, how efficient implementation of cashless and reimbursement schemes is possible in a country like India by real-time fraud prevention methodologies. Healthcare fraud is an issue all across the world, in every country, be it a very developed mature market or an emerging market, but it's particularly severe in India, especially in government-run schemes. Every day or every other month, we get a news article about a scam in RSVY, about fake cards being issued, about excessive billing that happens. There are estimates and surveys that say that about 15 to 25% of total spend is lost in healthcare fraud. That's a very high number. But as I said, the problem in India, approximately 20% of spend is wasted through fraud and abuse. In mature markets, it's more like 7%. Lots of studies, slightly different numbers, but this is where it averages out. This difference is attributed to more advanced fraud prevention infrastructure using big data analytics techniques, robust systems and processes that are implemented to support collection of data and allow implementation of analytic systems, And finally, the stronger regulatory framework, which is where the government has a major role to play. Our framework to control healthcare fraud essentially helps companies and governments move through a 5-stage process where they start with very, very basic pre-payment screening, pre-authorizations that pretty much everyone does. Begin doing reactive analysis of tips investigation if there is information that comes to someone acting on that information. Retrospective analytics, where you look at statistical relevant numbers. For example, why do I get all cesarean cases from a particular hospital, whereas clinically and statistically it's not possible that most of the deliveries in any given area are cesarean in nature. You apply this on past data, identify cases, and then you create prospective triggers to stop such incidences in a prepaid fashion, followed by making a neural network that makes your system smart enough to do predictive analytics and stop this fraud even before the claim has triggered. The use case 2 that I would talk about is for care providers, for hospitals, which is how do we track more effective clinical pathways? How do we make it real for patients? And I'll take a hypothetical example of a 60-year-old woman with hypertension who is diagnosed with sepsis of the left leg and was initially diagnosed with diabetes. Now this is a very, very acute illness case where the patient may lose a limb or may even end up losing her life. A typical care pathway that doctors, she obviously goes to a tertiary care center, obviously to the most senior doctor there, and the doctor, based on his experience, decides a particular clinical pathway. He still hasn't seen patients' live medical history. He hasn't seen a statistically relevant model of what patients like her have gone through in the past and what was the most effective depending on her disease condition, her comorbidities, and her lifestyle and demographic data. The tool that we have developed that runs very effectively in the US, that we have developed in partnership with Mayo Clinic, helps a clinician do this analysis in real time, between sips of coffee, literally, where 20 years of longitudinal data is turned to identify identical twins to a case like this, identical in terms of disease, comorbidities, age group, demographic and lifestyle factors. And based on that, the doctor can look at what were the most effective pathways. The insurance provider or the coverage provider can advise the patient on what is likely to be financial outgo for the patient. And eventually, hopefully, it leads to a soon-to-be cured and happy patient, knowledgeable patient, bringing in transparency, a happier doctor, and eventually healthier citizens. Finally, I will talk about the third use case for government-sponsored population health management programs and how private sector can play a role, how we have played a role in the United States working with government agencies in running what we call as Diabetes Prevention and Control Alliance. Diabetes, as we all know, is an endemic. It's a problem across the world, and it's increasingly a problem in India based on the lifestyle and affluence that we're seeing now. In the US specifically, 26 million people, about 2.6 crore people are diabetics. About 8 crore people, 7.9 million, are pre-diabetics. That is 35% of adult population is pre-diabetic. That's a very high number. And the outcome or the challenges that these people face is that diabetics lose 10 to 15 years of life eventually, and the life that they have is also not as good in quality. We recognize this problem. We worked with our 20-year-long data sets. We identified symptoms that triggered eventually a person to develop diabetes over his lifetime, several years, even decades before that person has developed any direct symptom to indicate diabetes. And then we work with the governments to identify and control this diabetic population, to help them with programs so that they never end up becoming diabetic. The medical cost implication is 1:5 saving for a person who does not end up becoming diabetic. How do we run it? We identify the pre-diabetic population. We work with our partners in the government Center for Disease Control and YMCA of America and local pharmacies to run this program where this person is incentivized to get on a wellness program and lose weight and get healthy. Eventually, we were recognized by several government agencies for this program, and we were given awards on healthy living and best US leader. So these are some of the options that can be possible as we talk about more effective delivery of healthcare to the citizen. Thank you.